everyone, welcome to our Chinese medicine study today. Now it's 20 past 10 in South Africa. Today we are going to talk about Ma Xing Shi Gan Tang. It's actually the full name of this formula. It's Ma Huang Xing Ren Gan Cao Shi Gao. And the ingredient of this formula also very simple and very easy to remember, because all the ingredients, they got one name from they choose one of the ingredients herbs name as the formula's name. So Ma Huang Xing Ren Gan Cao Shi Gao Tang, we also call it Ma Xing Shi Gan Tang. It only has 4 ingredients, which are Ma Huang, Xing Ren, Gan Cao, Shi Gao. This formula also from Shanhan Lun. In Shanhan Lun, it described as a patient when we already have used the sweating method. It doesn't matter have been used Gui Zhi Tang or Ma Huang Tang or Da Qing Long Tang. It doesn't matter which formula we have used, but the patient didn't become better. And at this stage, it's not recommended using Gui Zhi Tang again. This patient got another symptoms of sweating and gasping. There's not a lot of fever, not very severe fever at this stage. In this condition, we can use Ma Huang Xing Ren Gan Cao Shi Gao Tang. So it's described in Shanhan Lun. The main symptom of this formula, the patient must be gasping, which is breathing difficulty. So we use Ma Xing Shi Gan Tang when we see a patient like gasping or breathing difficult. We need to think. We need to find out the cause of gasping. In this condition, this patient, the gasping is not from it's actually the patient was attacked by cold, or the first cause, the patient was attacked by cold, and then the cold pathogen goes in the body, goes deeper in the body. It goes deep in the lung, and it makes the body change the pathogen into heat. So it becomes too much heat in the lungs. That's the first cause. The second cause, it might be the wound disease. So a patient may be attacked by wind heat. So these two causes. The first cause, how the cold pathogen become hot. It's actually very similar. If a lot of like the grasses, we put the grasses or products in the corner. We put a lot in the corner and then we keep there for long term. We don't move them. After a while, the products or the materials there become fermented. Inside the materials, it become hot. That's fermented. So in Chinese medicine or in our body, when something goes in the body and it becomes stagnation, it doesn't move, it's stagnate there, then it will become, the body will change the pathogen to heat pathogen. It also may, because of the property of the patient, the property of the body, if the property of the body was hot, when the cold pathogen goes in the body, the body also will change the pathogen to heat. So this patient, they got too much heat in the body. especially in the lung, you got the lung heat that cause gasping. So in this condition, we use ma huang, which is the lung herbs, one of the most important lung herbs. Ma huang and Xing Rong. Xing Rong can open the lung and can bring down the qi, which is ma huang Xing Rong. When we use together, can make the lung to regulates the lungs function, which is goes up and down. The down, when it goes down, it can help to relieve gasping. But ma huang, Xing Rong, these two are both warm in property. So remember when we talk about the cause of this disease, the cause of this patient become gasping is because of the lung heat. But in lung heat, we use a warm herb, so we need to use other herbs to balance the warm property of the ma huang and Xing Rong. Here we choose Shigao. Shigao is the property of Shigao is pungent and cold. So the cold property can balance the ma huang and Xing Rong, the heat, so it's a kind of balance. Also, Shigao got the property of pungent, so pungent can go to superficial. This also can benefit ma huang and to make the function to activate, to move the patient, to chase the patient from underneath to superficial. When we use this formula, we can adjust the dose. In some case, if the patient got very poor digestive function, we will reduce the amount of Shigao. Also, if the patient got not very severe heat in lung, so like the tongue is not very red, or the coating is not very yellow, and even you can feel from the pulse if the pulse is not rapid. So if any signs of the patient indicates the heat is not severe, we also can reduce Shigao. Because Shigao is pungent and cold, it's not good for the stomach. So when we use as in clinic, in our daily practice, we need to consider the patient's condition. If it's the digestive system, the whole condition, if the digestive system doesn't function well, we need to change the dose. And if the patient is not sweating, we may increase the dose of ma huang. Nowadays, there's a lot of practitioners that use Ma Xing Shi Gan Tang for pneumonia, for severe pneumonia. But remember, we need to check the patient's condition. We need to find out the cause. We need to conclude to a diagnosis of what's the cause of the pneumonia. So if because of the lung heat, we may use. If it's not because of the lung heat, we are not going to use Ma Xing Shi Gan Tang. So even for pneumonia, if it's due to lung heat, patient may have fever or may have gasping, we may use Ma Xing Shi Gan Tang. Thank you for watching our video today. For more information, you can visit our website. You can see our website in the comments.